stakeholders is underway in the Central River region. The bi-monthly convergence called for the coordinating committee meeting is the monitoring arm of the Ministry for Policy Implementation, credited with promoting quality education and the MDG goals the ministry is poised to achieve. Louis Mendy has details in this report.
Taking place inside this conference hall at the Sierra Regional Office is the Coordinating Committee meeting, in short the CCM. The 5-day bi-monthly interactive forum for officials of the basic and secondary education and stakeholders in the sector is credited for promoting quality education, and MDG the ministry is poised to achieve.
And basically what it does is to monitor policy implementation, because as you know, it's one thing to formulate a policy, but when it comes to implementation, it's a different ballgame altogether. And if you don't have a robust system of monitoring what is supposed to happen, the tendency is you will always have a gap between the policy statements and what happens on the ground. And CCM is our monitoring, arm of the Ministry for Policy Implementation.
Introduced in 2008, the CCM is the monitoring arm of the Ministry for Policy Implementation, and as PS Boy explains, its impact since then is obvious.
Really, that the impact, if I am to put it in simple terms, is that the activities that we have in our individual work plans or directed work plans, you can clearly see, when you go to the schools during the CCM visits, that a head teacher would say, I have planned activity X, and actually the activity will be implemented. So that's the simple impact that I can give you. Simple but very significant.
The top echelons at the Ministry of Basic and Secondary Education are custodians of the belief that what is not monitored doesn't get done. This is the more likely reason why delegates at this convergence will take a day outside the confines of this hall to visit selected schools within the region. The goal is to gather for themselves first-hand information on the state of affairs of schools in relation to policy implementation.
Part of the activities of the CCM is the school visits, which take us to 15 institutions, 3 madrasas plus 12 schools of the different categories: lower basic, upper basic, and senior secondary.
Alaji Gani Toure is the governor CRR. To him, the introduction of CCM is one best decision ever taken by the ministry under the starship of Minister Fatula Mimfai, PS Babukar Boy, and Mam Tamsin Jai of the ministry's broadcasting unit.
I don't know who came up with this idea, but this is the best move that has ever happened.
Once the regions are concerned, we really are in appreciation of what CCM offers in terms of supporting our work when it comes to monitoring and to ensure whether what is expected of the schools are in place.
This activity of the ministry highly demonstrates cordiality through intersectoral dialogue for the realization of one common objective: a nationwide conducive teaching and learning environment with policy implementation, especially in schools, for the realization of both standard and quality education for all. Louis Mendy, GRTS.
The drive to ensure improved sanitation and hygiene in local communities, the Ministry of Health, in collaboration with UNICEF, recently certified the status of 44 communities in the Upper River region for the completion of the construction of latrines. The initiative, as Babka Sengo reports, is for communities to control their own sanitation and hygiene with no cost from the government.
The community-led Total Sanitation is a local group which aims at helping communities control their own sanitation and hygiene. The group uses the services of well-trained and motivated personnel whose approach led to the 44 communities building latrines in each compound. Governor Umar Abu Khan informed The Guardian that in May 2012, 75 communities were accessed for those without proper latrines, which he says triggered authorities to conduct an assessment of 44 communities representing 59% of areas with adequate latrines. The governor, however, urged the 31 remaining communities to put up latrines and help the URR to sustain and consolidate its excellence before the MDG deadline of 2015.
Therefore, the region is on course to meet open defecation elimination by the 2015.
The development, according to the UNICEF official Musa Drame, is a testimony of government's commitment towards achieving the MDGs. The approach, he said, is creating avenues for communities to control their sanitation, as diarrhea is one of the top 3 killers of children under the age of 5 in the country. According to Drame, sanitation improvement can significantly reduce child mortality.
As diarrhea is one of the top 3 killers of children under 5 years old in the Gambia, sanitation improvements can significantly reduce child mortality.
Alhaji Sankare, Regional Director, is of the belief that the community will uphold its new status.
But now that they have realized the benefits of, CLTS, and so from this point we are able to continue to uphold the sanitation in our various communities from strength to strength.
The delegation of health officials later went on a tour of some of the community latrines to see conditions at the facilities. From that eventful program, the governor of the region, on behalf of the St. George's Guilds, handed over 20 hospital beds and hospital materials worth over $300,000 to the Basse Health Center. The items were donated by St. George's Guild from Denmark through the Scouts and Guilds Fellowship. For Grts News, this is Babukar Senghor.
The World Health Organization, in collaboration with the Mental Health Leadership and Advocacy Program under the Ministry of Health and Social Welfare, Monday kick-started a 6-day convergence for health practitioners. The mental health training, as we hear in this report by Babakar Kamara, is designed to prepare participants to be advocates of mental health care across the country.
Call it mental health or psychosocial disorder, whatever name you give it. This problem is one of the world's leading health challenges that continue to receive little attention from both governments and health practitioners alike. Reapping families of loved ones in a crude manner may not be all that it does, but lead and continue to lead an overwhelming majority of its victims into poverty, poor physical health and right abuse. At the Thrive Mental Health Training organized by WHO in partnership with the Ministry of Health and Social Welfare through the Mental Health Leadership and Advocacy Program, the Health Promotion Officer at the WHO gives startling revelations on the global impact of the mental health, saying that in about 35 years to come, trillions of dollars will be lost in mental health-related problems.
By 2050, the world is going to lose $47 trillion. Trillion, I'm not talking about billion. The world is going to lose $47 trillion as a result of non-communicable diseases. And the same Lancet says 1/3 of those losses will be due to mental disorders.
As a catalyst to help development, mental health care Gassama Beaumont face great isolation in focus both from institutions and health practitioners, whose number on a global level compared to the cases at hand is very irrelevant.
Look at the Lancet says what they're saying, or WHO, is that 0.05 psychiatrists to 100,000 population. This is serious. For every 100,000 population, you have 0.05 psychiatrists in the developing middle and low income countries. And this is 170 times higher in the developed countries. If you compare 170 multiplied by 0.05, my arithmetic tells me it's about 8 point something. So we have 8 psychiatrists to 100,000 population in the developed world. Is still enough? It's not enough.
Yet these statistics represent the realities for countries like the Gambia. But if the words of the Chief Nursing Officer are anything to go by, the Health Ministry is taking bold steps to widen its free mental health care programs to meet growing demands of the country.
Estimates indicate that between 90,000 to 118,000 people, including those in our homes and offices, have some form of psychosocial distress. As a ministry, we have the greatest stake on mental health, and that our free mental health services through the community mental health team are attracting patients not only